Good day. My name is Sebastian Wingen-Heimann, and I'm a research associate at the Institute of Translational Research at CECAD at the University of Cologne. Today, I would like to present you some basics in health economics. So coming to the structure of my talk, first of all, I would highlight the ISPOR Society as well as the literature to which I also refer to in this talk. For example, some adapted figures are used from the Drummond and colleagues book within these presentations. We also would like to look at some basics in health economics. For example, the question, what is health economics? The triangular relationship between some disciplines. A further important question, why is health economic evaluation important? As well as some health economic questions of interests. And then we would like to look at a cost-effective diagram and different types of costs, and also different types of perspectives. So coming to the ISPOR, the leading professional society for health economics and outcomes research. The ISPOR's main goal is to improve decision-making for health globally. This is the free available version of the book by Michael Drummond and colleagues, entitled Methods for the Economic Evaluation of Healthcare Programs. A very important book for health economists and in preparing health economic evaluations. So coming back to the main question, what is health economics? Health economics deals with the problem of allocation of healthcare resources under conditions of scarcity and uncertainty. The primary aim is to maximize the overall healthcare conditions with limited resources. But what is meant with limited resources? Each monetary unit invested in healthcare cannot be spent elsewhere, for example, into the education system or the treatment of another disease. So look into the increase of healthcare conditions, here highlighted in the middle in yellow. So, and we do see that many factors have an impact on the healthcare, on the increase of healthcare conditions. For example, the monetary values available, for example, in a country. Also, the access to healthcare resources, which might be different between some countries. Also, ethic principles, the scientific evidence, agreements, rules, laws, and/or partnerships. And in best case, we also do see a sustainability of healthcare decision for increasing the healthcare condition. Look on the triangular relationship, we do see that three main disciplines are important in healthcare decision-making. We do see the economics, the politics, and the medicine. And these three disciplines are making a triangular relationship. Why is health economic evaluation important? Any healthcare-related resources are limited. Examples are personal, time, environmental resources, facilities, equipment and material, knowledge, and money. Look on comparative analysis of alternative courses of actions. We positively most often have a choice, for example, between program A and program B, or more than two programs. But each program costs money and has a consequence. Some health economic questions of interest are, for example, should all patients receive an MRSA swab before admission to hospital? Or should planners launch layperson resuscitation training in secondary schools? Or should individuals be encouraged to request annual cancer checkups Or last but not least, should a new drug be implemented in local treatment guidelines? So look into the cost consequence questions. And coming back to our first question, should all patients receive an MRSA swab before admission to hospital? We do see on the left-hand side the costs. For example, for the equipment and the one-way material, what is used, the personnel which has to be available, or lab capacities have to be available as well. The consequences are, for example, a reduced risk of nosocomial infections, an impact on morbidity and mortality, a prevention of drug resistances, prevention of local outbreaks, and an effective antibiotic therapy might be possible. So coming to our second question, should planners launch layperson resuscitation training in secondary schools? On the left-hand side, the costs. Again, the equipment has to be financed and maintained. The personnel has to be available as well, and capacities and school plans have to be ensured. The potential consequences are a reduced mortality rate due to cardiovascular arrest, an improved neurological outcome, an increased quality of life, less long-term care costs, and a higher return to work rate. Our third question could be, should individuals be encouraged to request annual cancer checkups? The costs are advertising and campaigns, and outpatient care capacities have to be ensured. The potential consequences are an early detection of malignant cell changes, less overall incidence rates of cancer. The early detections means that non-invasive treatment might be possible, an overall improved outcome rate, and a higher return to work rate as well. The last question, should a new drug be recommended for treatment? I will be highlighted in a cost-effective diagram, which is presented now. So on the x-axis, you do see the effectiveness, and on the y-axis, the costs. And in the middle of this figure, we do see the drug A, which is for example, gold standards of treatment of a disease. And now we would like to compare drug A to drug B. And we now do have potential scenarios comparing drug A to B. So the first scenario is B1. B1 means that drug B is more costly and more effective compared to the gold standard treatment A. The second scenario will be B2. B2 means that B is more effective and less costly compared to A. The third scenario is that B3 is less effective and less costly compared to A. And the fourth scenario is B4, which means that it is more costly and less effective compared to A. So now we do see two very clear decisions that we can make where we are indifferent. So the indifferent scenarios will be B1 and B3. We can clearly decline the scenario B4 because it doesn't make sense to implement a new drug which is less effective and more costly. And we also do see a clear decision towards B2, which means that the new drug is more effective and less costly compared to A. So this is a very simple overview regarding the cost-effective diagram. Now I would like to highlight some different types of costs. When we're talking about costs, we do talk about resource costs, productivity costs, and opportunity costs. Some examples for resource costs are hospital services, community health services, medication, diagnostic and laboratory tests, rehabilitation measures, for example, also travel expenses, household help, or illness-related conversions and purchases. Look on the productivity costs. We can calculate the illness-related disability as well as the death before retirement age. And look into the opportunity costs. We can calculate the missed revenues due to blocked beds in the hospital. But this means we do have a hospital management perspective. But what about the clinical effectiveness? So on the one hand, we do have the costs, and on the other hand, we do have the clinical effectiveness. And the clinical effectiveness is most often used from, for example, randomized clinical trials, meta-analysis, systematic reviews, clinical trials, case or case control studies, or observational studies. And last but not least, we can also have a look on different types of perspectives. So on the x-axis, you do see the agencies considered, and in the y-axis, the follow-up time. So the shortest duration is the short-term perspective. For example, we look only on the inpatient treatment period, for example, in the hospital. The medium-term perspective means that also other healthcare-related agencies, for example, rehabilitation facilities, are included in this cost calculation. And the long-term perspective means that, for example, also patient, family, and friends, or reconstruction measures in your own house are observed for this type of health economic evaluation. So consequently, or logically, a long-term perspective means higher costs compared to a short-term perspective, which is used for health economic evaluation. Coming to our conclusion and our key messages. Health economics is an interdisciplinary science. Health economics stands for a fair distribution of healthcare-related resources. Health economic evaluation tries to expand the body of evidence, and health economics is important for decision-making in healthcare. So thank you very much for joining us today. And if you have any questions or remarks, you can contact me via email. Thank you. Goodbye.